victime par la pluie. Ma péritane journée, journée wa va pour moi mener walé. Depuis that man la ma bin victime par la pluie. Ma péritane journée.
happy Global Day of Action from here, Rusumo Stadium in Butaro. This day reminds me of Dr. Paul Farmer, a hero who once lived, and I am thankful that I actually met him. So he instilled in us principles of equity, that is to value every life of a human being as a life. I mean, there is no one who is better than the other.
We are here commemorating the life of our dearly beloved Dr. Paul Farmer, who taught us that you have to work with the people to work for the people.
Testing.
So I'm here to remind you, also I remind myself that we have to get closer to the people, especially those who don't have people.
Good morning once again.
I
just wanted to give you a little bit update. We have, our guests have arrived. We have the governor with us right now, and our international guests have just arrived. Nagira ngo bamenyeshe yuko muri aka kanya abashyitsi bacu bamwe bamaze kuhagera, turi kumwe na governor yahageze n'abashyitsi bavuye kure mu mahanga nibwo batugeraho. They are going to have a cup of coffee and then they'll go for a hospital tour as we keep waiting for them. Murakoze.
Got the vibe, she my type. She freaky, make a nigga go mad. Body bad, you the owner.
What you mean, say know me,
Defeat the city, I got the keys. I pussy jelly, I panic a driver. Pull up on me, we keep it low key. One Jesus so crazy. You make it so real. Just you and I. Got me for the love. You know I'm in love. Plenty love. Take me deeper, baby. Tell me if you're ready to be mine. You keep my balance, fulfill my desires. Keep it calm, nyumbani, usijali. African gorgeous queen dad. Can I call you baby Shiba? Oh nana, I know he's a tomorrow. I be the local. Jesus so crazy. You make it so real. Busy like Osawa. Oh baby, take control. The rules is just you and I. Got me for the love. You know I'm in love. Plenty love. Take me deeper, baby. Tell me if you're ready to be mine. You know I'm in love. Plenty
Advocating for patients, the better is coming.
Neonatal intensive care unit is a defined place in the hospital. It's a ward or a unit where we admit sick newborns, either preterm or term babies who need medical attention. So we admit babies who are preterm and sick from our maternity and also from different health centers in the Kirehe District Hospital catchment area.
Our maternity and child newborn services are very busy compared to other districts. We serve around 450,000 from 12 sectors and Mahama refugee camp.
Monthly, we usually admit around between 120 to 160 babies per month.
NICU helps to reduce the premature death. So without NICU, many premature babies will die from many causes like infections, like hypothermia.
Ndi umumama w'abana babiri mfite ubumuga bwo kutabona kuva mfite imyaka 5 y'amavuko. Urugendo rw'ubuzima nari mfite mu gihe cyashize bwambereye rubi cyane bitewe no kuba mfite ubumuga. Haje nakoze amazina nitwa Nyamwiza Sauti. Ndi umumama w'abana babiri mfite ubumuga bwo kutabona kuva mfite imyaka 5 y'amavuko. Urugendo rw'ubuzima nari mfite mu gihe cyashize bwambereye rubi cyane bitewe no kuba mfite ubumuga. Hajeho kubyara abana ntafite umfasha kubarera, hazaho kutagira aho kuba. Umva numva ndi mu mashimwe kuko ubuzima bwatangiye koroha njye n'abana banjye. Mwebwe rero aho muziye mu buzima bwanjye nabonye muri mwarabaye igisubizo cy'ibibazo nari mfite. Mu by'ukuri numvaga nta herezo ry'ubuzima pe. Nkibaza icyerekezo abana banjye aho bazakurira bikanyobera, nkareba ko bazakura nk'uko nakuze nkumva agahinda karanyishe. Ariko ni ukuri numva nshimye Imana kuko natangiye kugira icyizere cy'uko abana banjye batazabaho nk'uko nabaye. Igihe nabayeho narabuze uwundenganura cyari kinini. Ubu aba bantu bose bari bateraniye aha, hari abigeze guterana barutaba ariko bataje kumpumuriza ahubwo baje kundiza. Njyewe nabayeho mbana n'abantu, igihe kiragera banteruraho inzu barayisenya barayijyana nsigara ku gasozi. Narabitekerezaga nkumva ari akarengane gakomeye, ariko noneho ukumva ijambo rivuga ngo akarengane kabonewe umuti. Nkabihuza n'abantu mbonye aha ngaha banzaniye ibyishimo, nkabihuza n'abantu baje aha ngaha mbona baje kundema no kunyubaka ngo nanjye mbeho. Byangaruriye icyizere cy'ubuzima koko mpita mbona ko akarengane kabonewe umuti. Hari ibintu byinshi byahindutse mu buzima bwanjye. Nibonyemo ko ndi umuntu, numva mfite umunezero n'ibyishimo. Ndaryama nkasinzira sindare nshiguka ngo mu byo nahoranye nabyo. Numva natwe twaribonyemo abantu kandi dufite icyizere cyo kubaho kandi tukabaho neza.
itangazo rindi nagira ngo
In the hills
mbasangize
of Rwanda,
nuko igihe tugezemo abashyitsi bacu bagiye muri hospital tour. Kubw'izo mpamvu rero tukaba twagira ngo dusabe abandi baganga bicaye hano, twifuzaga ko mubana nabo mwabegera bahagurukiye kuri TC tukabaherekeza muri tour bagiye gukora. Ikindi abo dusigarana muri tent hari zino videos turimo kugenda tureba impande n'impande twazikurikirana n'ibikorwa bya PH niturambirwe dukomeze twihangane dutegereze abashyitsi bacu nibagaruka tubone gutangira umuhango w'uyu munsi. Murakoze.
So if you're seeing some people walking out of the tent, they are going to the hospital tour. We would like to call upon all clinicians and physicians to join our guests who are walking down to the hospital for the tour. Thank you.
In the hills of Rwanda, healing began not only with medicine, but with understanding, equity, and connection. This is a story of transformation, a story of how communities that once had little access to care are now working hard to improve mental health support for all.
Mbere tutarabona amahugurwa abarwayi bo mu mutwe twabafataga nk'ahari abantu barozwe, nk'ahari abantu bafite ibibi bakoze biri kubagaruka, nk'ahari amashitani yabateye n'ibiki byose, mbese natwe twari dufite imyumvire nk'iy'abaturage basanzwe.
Rwose pe mbere patinasi itaraza ntabwo iyo serivisi yabagaho. Abarwayi bo mu mutwe babaga mu giturage bakabafungirana bakababoha, abandi bakabashyira mu mapingu bakumva ko hari imyuka mibi, ntabwo ibyuvuzi byatekerezwagaho.
When we moved to the Burera district, around the Butaro hospital in 2008, we started encountering some serious mental health cases and realizing, of course, that after the genocide against the Tutsi in Rwanda, the country was still rebuilding its health workforce, and there was only one psychiatrist in the whole country. So given that we had some specialists who had the expertise, we decided, in collaboration with the Ministry of Health, to start taking care of mentally ill patients in Burera and to provide the care that was so much needed, and of course thinking about how to decentralize the care that was only available back then in Kigali, which is the capital city.
The PIH mental health program was launched in 2011 in Burera district, and in 2011 it's where actually in collaboration with the RBC, Rwanda Biomedical Center, we designed a mesh mental health model which was focusing on mentorship, supervision at the health center level. In 2014, we decentralized the services from hospital level to health center level, where clinical mentors in mental health were going to the health centers to support nurses and the other mental health professionals to provide mental health services.
Minisiteri y'Ubuzima ku bufatanye n'umuryango Inshuti mu Buzima bahuguye abaganga, bamaze guhugura abaganga natwe baraza baraduhugura ku kigo nderabuzima. Ubwo tumaze kubona amahugurwa batubwiye bimwe mu bimenyetso by'indwara zo mu mutwe, batubwira igishobora gutera uburwayi bwo mu mutwe, batubwira amoko y'indwara zo mu mutwe kuko zirimo amoko menshi, batubwira uburyo twafasha umurwayi wo mu mutwe. Ibyo byose tumaze kubimenya rero imyumvire yarahindutse. Ubwo tubonanye ikimenyetso icyo ari cyo cyose twihutira kumujyana kwa muganga, tukamuherekeza tukamushyikiriza muganga ushinzwe iyo gahunda, noneho bakamukurikirana. Iyo bamaze kubona ikibazo afite bamwohereza mu mudugudu, akaba arimo tumukurikiranira.
Serivisi zegerejwe abaturage hano ku kigo nderabuzima, imiti irahari ku bufatanye na patinasi, ntacyo badakora. Iyo tudafite barayiduha, mbese abarwayi bacu ntibagisiragira bajya kure, imiti bayifatira hano. Ikindi, ibyo by'akato n'ihezwa byaragabanutse, kuko umurwayi wo mu mutwe ni umurwayi nk'abandi, afata imiti ubuzima bugakomeza.
The person who was initially called mad was called fool, now being called a person who is contributing positively to the progress of the community. We have so many people now in the self-help groups who are learning new In 2014, we decentralized the services from hospital level to health center level, where clinical mentors in mental health were going to the health centers to support nurses and the other mental health professionals to provide mental health services.
Minisiteri y'Ubuzima ku bufatanye n'umuryango Inshuti mu Buzima bahuguye abaganga. Bamaze guhugura abaganga natwe baraza baraduhugura ku kigo nderabuzima. Ubwo tumaze kubona amahugurwa, batubwiye bimwe mu bimenyetso by'indwara zo mu mutwe, batubwira igishobora gutera uburwayi bwo mu mutwe, batubwira amoko y'indwara zo mu mutwe kuko zirimo amoko menshi, batubwira uburyo twafasha umurwayi wo mu mutwe. Ibyo byose tumaze kubimenya rero imyumvire yarahindutse. Ubwo tubonanye ikimenyetso icyo ari cyo cyose, twihutira kumujyana kwa muganga, tukamuherekeza, tukamushyikiriza muganga ushinzwe iyo gahunda, noneho bakamukurikirana. Iyo bamaze kubona ikibazo afite bamwohereza mu mudugudu, akaba arimo tumukurikiranira.
Serivisi zegerejwe abaturage hano ku kigo nderabuzima, imiti irahari ku bufatanye na patinasi, ntacyo badakora. Iyo tudafite barayiduha, mbese abarwayi bacu ntibagisiragira bajya kure, imiti bayifatira hano. Ikindi, ibyo by'akato n'ihezwa byaragabanutse, kuko umurwayi wo mu mutwe ni umurwayi nk'abandi, afata imiti ubuzima bugakomeza.
The person who was initially called mad was called fool, now being called a person who is contributing positively to the progress of the community. We have so many people now in the self-help groups who are learning new nurses and the other mental health professionals to provide mental health services.
Minisiteri y'Ubuzima ku bufatanye n'umuryango Inshuti mu Buzima bahuguye abaganga, bamaze guhugura abaganga natwe baraza baraduhugura ku kigo nderabuzima. Ubwo tumaze kubona amahugurwa batubwiye bimwe mu bimenyetso by'indwara zo mu mutwe, batubwira igishobora gutera uburwayi bwo mu mutwe, batubwira amoko y'indwara zo mu mutwe kuko zirimo amoko menshi, batubwira uburyo twafasha umurwayi wo mu mutwe. Ibyo byose tumaze kubimenya rero imyumvire yarahindutse. Ubwo tubonanye ikimenyetso icyo ari cyo cyose twihutira kumujyana kwa muganga, tukamuherekeza tukamushyikiriza muganga ushinzwe iyo gahunda, noneho bakamukurikirana. Iyo bamaze kubona ikibazo afite bamwohereza mu mudugudu, akaba arimo tumukurikiranira.
Serivisi zegerejwe abaturage hano ku kigo nderabuzima, imiti irahari ku bufatanye na patinasi, ntacyo badakora. Iyo tudafite barayiduha, mbese abarwayi bacu ntibagisiragira bajya kure, imiti bayifatira hano. Ikindi, ibyo by'akato n'ihezwa byaragabanutse kuko umurwayi wo mu mutwe ni umurwayi nk'abandi, afata imiti ubuzima bugakomeza.
The person who was initially called mad was called fool, now being called a person who is contributing positively to the progress of the community. We have so many people now in the self-help groups who are learning new
kuko umurwayi wo mu mutwe ni umurwayi nk'abandi, afata imiti ubuzima bugakomeza.
The person who was initially called mad was called fool, now being called a person who is contributing positively to the progress of the community. We have so many people now in the self-help groups who are learning new
n'ihezwa byaragabanutse.
This is part of the Butaro Hospital expansion project. What you are seeing behind me is the expansion. It has two phases. There is the first phase, which is the one you are seeing here. And in this phase, we also have some work going on inside the hospital. So we are doing some remodeling work inside the hospital, and this expansion as part of the phase one. Phase two will include more buildings for the wards, for patient wards, and that is coming up next. We began in November with the internal remodeling, and this one we are seeing here started in January, and we are progressing well. This expansion, for the remodeling part, we are targeting to increase the capacity, especially surgical capacity of the hospital. For this part here in the expansion, we are targeting increase of oncology beds and emergency services, as well as imaging services, which were not there before. We have average of 150 people working on this project on a daily basis. And the second aspect is also on the side of the people who are working with us. in terms of supply of local material, like this sand you are seeing here, the aggregates, all of these are coming from this area. So that's a second part. And another also is people who are doing their business down here. So when workers needs where to stay or to eat, they use local restaurants, they use local accommodation services. And in that sense, we are seeing that this project, this kind of project, gives the opportunity to local business people as well as local laborers. The first phase is ending with December this year. So we're trying to hand over the first phase toward starting of January 2023. And the plan was to continue with the phase 2, and that was projected to complete in August 2023.
Happy Global Day of Action from here, Rusumo Stadium in Butaro.
This day reminds me of Dr. Paul Farmer, a hero who once lived, and I am thankful that I actually met him. So he instilled in us principles of equity, that is to value every life of a human being as a life. I mean, there is no one who is better than the other.
We are here commemorating the life of our dearly beloved Dr. Paul Farmer, who taught us that you have to work with the people to work for the people. So I'm here to remind you, as also I remind myself, that we have to get closer to the people, especially those who don't have people to reach out to them.
One main thing that I learned from him in our month that we had through his social justice course was that there is no meaning to words without action. And this is what today speaks about.
Every year, we celebrate Paul's birthday, and this year we're choosing to focus on his twin commitment to empathy and action, sharing in others' feelings and working hard on their behalf, staying close, commitment that can be summed up as his pledge to act in pragmatic solidarity with the poor. To him, pragmatic solidarity meant using all of one's power to diminish unjust hardship.
Turakukunda Paul Farmer.
Neonatal intensive care unit is a defined place in the hospital. It's a ward or a unit where we admit sick newborns, either preterm or term babies who need medical attention. So we admit babies who are preterm and sick or sick from our maternity and also from different health centers in the Kirehe District Hospital catchment area.
Our maternity and child newborn services are very busy compared to other districts. We serve around 450,000 from 12 sectors and Mahama refugee camp.
Monthly, we usually admit around between 120 to 160 babies per month.
NICU helps to reduce the premature death. So without NICU, many premature babies will die from many causes like infections, like hypothermia. They are exposed to many infections due to their immunity is very low. So a good NICU helps to reduce the premature death, and in the long run will lead to reduction of under 5 mortality.
We renovated this unit because we wanted better improved infection prevention and control, and also improvement of family-centered care.
Ni ukuvuga mbere ibitaro bitaraguka ngo babyubake wabonaga hari impungenge nyinshi zitandukanye nta bwinyagamburiro ababyeyi babonaga.
One of the things that struck us when we were doing our clinical work was that the patient flow wasn't correct. Now we have two main interests. One is for everybody, so mothers, visitors, people coming from outside the neonatology, and the other one is a staff entrance. For the main entrance, what we transformed there was that now we can get an easy entrance from an ambulance. Otherwise, they had to pass either through maternity or through another ward of the NICU and pass through patient, like in the patient space. At the entrance, every mother will have a place where they can change and come into neonatology unit easily, and with a hand washing station. So all that improves family-centered care, of course, but also infection prevention and control. We have different wards in our unit. We have 2 wards for full-term babies. The first ward is for which is called Ward 1, is for babies admitted, full-term babies admitted from the community and from the different health centers. The second ward is a ward for the full-term babies coming from the hospital. The fourth ward is the kangaroo care room, where we admit babies who are more stable but who are preterm and before discharge, so we teach them to do kangaroo. So that's where they practice kangaroo mother care, feeding, until they grow up to 1.800 grams, and then they go home. And then the last ward is the incubator ward, where we admit babies, preterm babies who are unstable and who need more clinical attention and management, and who need incubators for thermoregulation. The other change was having a room for mothers who have babies in the incubator room. So that's an extra room that we added to the unit, which has 4 beds, and those beds are occupied when a mother needs to rest at any time of the day or night.
Bose ubona ababyeyi byarabashimishije cyane, niyo bonsa abana babona bafite morale bakavuga ati bya birometero twagendaga mana warakoze kubera ko tubonye inyubako tukegera abana bacu.
The vision of PIH in Rwanda is to be a friend of all the mothers, then ensuring that no mother dies or suffers any injury or any morbidity from delivery. Also ensuring that all the newborns are born safe from any morbidity or injury as well. And also to ensure that the child and adolescent, they grow well to fulfill their vision in life.
It's a good partnership we do have with partners in health, as the name stipulates itself, because they are making a good accompaniment to our hospital. There are many materials we could not afford to buy regularly or on time, while they are the equipments and the materials that are needed for our patients. Again, there are some skills that our staff, existing staff, are not having, but partners in health is supporting us in the capacity building of our staff by providing regular trainings, quality improvement trainings, leadership trainings, and many other trainings, not only for the hospital staff, but also for the staff in our catchment area who are serving patients.
What we are doing now with the government of Rwanda is to develop protocols, develop guidelines that are at the central level, and to support the government in all activities that are related to maternal, newborn, child, and adolescent health at a high level. Specifically for Kirehe, this will be a center of excellence for maternal, newborn, and child health. We have many projects that are ongoing. One is, as you have seen, the NICU. We have renovated it, and now the biggest challenge ahead of us is equipping it.
Our neonatology unit, it is like a triage itself. Before entering it, you can immediately say this is the critical area of the neonatology, and this is the other area remaining for the neonatology. So it will improve the service, it will improve the quality of care, and it will be a friendly space for our medical staff who are working in the neonatology.
So as a clinician and also a mother, with the space, the new space that we have today, I would feel more comfortable.
I really describe nurses as hero, and I describe them as the heart, as Dr. Paul Farmer said, that nurses, they are the heart of the healthcare system. They are the heart, they are the backbone, they are the legs, because they want to stand first. And they are the voice, because the system gets informed from the patient need, from the mouth of nurses. Oh, I have been a nurse for the last 20 years, almost 22. It is a profession which makes foundation for the nation, because it really ensures that the health population is preserved and saved.
The role of nurses in a health system, if I take an example of our setting, nurses are everywhere in all levels of our health system. I take an example of mental health patient. You see, we identify them through community screening and then treat, and then after, when they are like recovered, we accompany them to the community for community reintegration.
Tukaba twamanutse turi gusanga abaturage mu midugudu yabo, mu tugari, mu bigo nderabuzima, tubigisha, tubashishikariza ku ndwara zugarije isi muri rusange, harimo indwara y'umwijima yo mu bwoko bwa C, hakabamo n'indwara ya kanseri y'inkondo y'umura, aho tubigisha abemeye tukaba twabapima, hanyuma twamara kubapima abo dusanze bafite ibibazo tukabavura. Ntabwo umwuga w'ubuforomo ari twe duhamagara uburwayi, ariko by'umwihariko nkunda kuba tubonye umurwayi urwaye ukeneye ubufasha, tukamuvura kugeza ku rwego rw'uko asubira mu buzima busanzwe, akongera kuba umuntu nk'uko natwe turi umuntu ushobora kwifasha ibyo ubundi yari asanzwe yifasha atari umurwayi.
We do still have a challenge for the number of nurses. When you go to nurse-patient ratio, we're still having really inadequate number for nurses to care for patients, to satisfy needs for our community. We are calling everyone to invest in nursing.
As our mission is to strengthen health system, so PIH is there and empower nurses through varying like tools, infrastructure,
DJ,
like simulation labs. We have.
Hello. Another small update is that our guests have finished the hospital tour, and they are moving on to the next session, which is tree planting. So I think it's the right time now. If you want to ease yourself, we know the direction. You can go for a short call. Just 2 minutes will be quite enough. As we get ready, twakira abashyitsi bacu muri tent. Ni ukuvuga ngo hospital tour bari bayisoje, bagiye ku muhango ukurikira wari uwo gutera igiti. Nibava hariya baraza bagana tent twicayemo. Nekereza ko uyu ari wo mwanya mwiza wo kuba waba ashaka kwihagarika se yakoresha uyu mwanya neza iminota 2 kugira ngo abashyitsi bacu nibaza basange twicaye twiteguye kubakira.
Turagira ngo tunabibutse yuko logistical team yatubwiye ko turi bukoreshe ubwiherero bwa hano haruguru. Murakoze. Let's be back here in less than 5. Thank you.
Paul Farmer is that rare person who connects to a moral truth and devotes their entire life to helping those who need it and inspiring other people to come do the same.
There's this ongoing debate in global health about what is the cheapest intervention we can get that'll save the lives of most people. I'm so tired of hearing that. That shouldn't be the first question we're asking.
Ikindi, as housekeeping
What do you do if in a place like rural, central Haiti, no electricity?
tugerageze dukipinga telefone zacu muri silence or vibration. Ikindi mwabibonye uburyo abayobozi bacu batwibukije ko turi bugerageze kudahaguruka cyane. So just something to be mindful before our guests come in. Thanks.
In Haiti, in Rwanda, his organization goes out into very tough places and they bring in doctors from the US, but over time they are training the local people and providing levels of health service that most people would say should be out of reach.
This is going to be a new hospital.
He innovated on how you can help an entire community even beyond their health needs.
Instead of having cultural competence, what we really need is cultural humility. Because if you have cultural humility, then you can say, you know what, I really don't know enough about this place.
In Haiti, Paul learned to speak the local language. And as we'd go to a new group, at the start, often somebody would give kind of a long thing and we'd sit there and wait for him to translate it. They were saying, almost certainly saying, hey, Dr. Paul, you saved our lives. It's incredible. You know, we're so glad you're here. You bring these new medicines, you train people. You know, he wasn't going to pass that along, speaking about himself. So he would just say obligatory praise. He wanted to get to the meat of, okay, what more can we do? And, you know, let's hear that.
In 2010, there was absolutely zero emergency medicine training program in Haiti, none. So in the years since, every year we've graduated this team of urgent care people. Most of them are young women, and I saw them all over southern Haiti. It was just the most moving thing.
Well, there aren't many real heroes where the purity of their commitment and their way they articulate those values inspires, you know, millions of people. We'd all aspire to be like that, but very, very few are. It's a tragedy that he died young. I hope Paul's values and dreams stay strong, even without him here setting such a profound example.
I think once in a while we're all guilty of failing to underline how redemptive, joyous, positive this work is. If you follow some simple rules that I learned from the Haitians, every single one of your endeavors will be met with some measure of success. There is so much uncertainty in terms of outcome, but not in global health. If you follow these basic rules, people are going to get better.
I mean, you gotta love this job.
abana babiri umwe yavutse 2011 afite imyaka 9 undi yavutse 2015 afite imyaka 4 n'amezi 4 kugira ngo menye ko aba bana banje bafite ikibazo mereye ku mukuru wa mbere ari w'imfura we namuhagarikaga nkabona ko amaguru yadakomeye adahagara nk'izindi minji uwo wa kabiri we yaragagaraga
umwana wanjye afite umwaka n'amezi 8 imbogamizi nahuye nazo mu mikure y'umwana wanjye akivuka isenye muri iyo minsi yaramfashije ariko nyuma abonye ko umwana afite ikibazo ahita anyanga nyine namuhamagara akanyirengagiza akambwira ngo ntiyabatazi nyina ngo amenye umwana.
Parents, families with children with at risk and with disability face many challenges including stigma and poverty and lack of services to provide the care to those children.
uyu mwana wa mbere nabyaye pedisi yari itari yabaho, patinasi yari ariko pedisi itari yabaho, ariko umwana wa kabiri nabyaye hariho ikigo cyitwa pedisi gikurikirana abana bafite ubumuga bukomatanyije.
Serivisi dutanga muri serivisi ya PDC icyo byafashije ababyeyi, umubyeyi aza amaze igihe kirekire muri Neonatology, ako yaje tukamufasha uko aza atiyakiriye, atakiriye na wa mwana. Iyo tumufashije wa mwana yari afite ibiro bikeya, abasha kuzamuka, bya biro bye bikazamuka, hanyuma umwana akagira imikurire myiza.
PDC is one of the innovative programs provided at community level that provide structured follow-up to children born with prenatal complications to improve their nutrition, health, and developmental outcomes. Before PDC, 10% of children discharged from neonatal units were dying before reaching their age 2. 79% of them were having stunting, and above 70% were having potential disability.
Aho ntangiye kugera muri PDC mu matsinda y'ababyeyi bafite abana bafite ubumuga, impinduka nabonye ku mwana wanjye. Uko nagendaga mukorera imyitozo n'imbere ntiyihindukizaga, ariko uko mwubika akaryama yubamye, ukuntu ngenda mukorera nyine imyitozo turi hano mu rugo, ubu ngo asigaye azi kwihindukiza.
Ubufasha patinasi yamaye mu by'ukuri bwangiriye akamaro, kuko aho abana banjye bari ntago ariho bakiri. Nk'ubwo nagiye kubakurikirana aho ngaho muri PDC bifashijwemo na patinasi. Umwana wanjye mu by'ukuri ni ubuhamya bukomeye, kuko banyigishije ukuntu ngomba kumuterura, banyigisha ukuntu ngomba kumugaburira. Mu kuri umwana wanjye yari ari mu mutuku, ariko kugeza ubu maze guhabwa ubufasha na patinasi, kugeza ubu ari mu cyatsi.
We are currently working in Rwanda and Kirehe district hospital catchment areas. There are many health centers located far from the district. With one of the health centers, the current have to make over 20 kilometers distance to reach out to the hospital. So we want that the services are available at the near place of the families. We are planning to extend the services to reach out more clients and families in Kirehe, and with that we plan that we can have 400 children who are not able to access our services during this time, and if with that expansion of the services to all health centers in Kirehe, that will ensure that all those families and children who are at risk of developmental disability are accessing the services without challenges.
Patinasi inshuti mu buzima ikintu yagiye imfasha, yagiye turwanaho, ubwo tukabona kuno twafata iyo miti ntiducike intege kubera kubura itike.
The oncology patient that we see in Butaro Hospital come from all over the country. So you can imagine the logistic nightmare. Missing the treatments or even missing few days of that treatment really reduce their chances of an effective response of the drugs a lot.
Tukimara kumva ko iki cyorezo cyateye, twagiye kwibaza ukuntu tuzabona imiti. Turavuga tuti noneho rero urupfu rwacu rwageze nta kuntu tuzongera kubona imiti.
For people who had chronic diseases, the Ministry of Health had clear guidance in terms of how many medicine refill they can have for 2-3 months so that they don't need to move. But there is another category that is quite special, which is patients in our oncology program.
The discussions have been initiated by partners in health, but later on we have been also looped in as the government, as the institution overseeing cancer care in the country, And we found that this might be an innovative solution to deliver quickly drugs to those patients that cannot travel from their home to come to those treatment centers.
Partnership rero nk'inshuti mu buzima iradufasha, twarahamagaye batubwira ko bashobora kuzatwoherereza imiti, ubwo umutima uratuza. None rero ubu turabishimye kubera ko tubonye imiti, tutongeye no kuvunika cyane ngo duhangayike twongere gukora rwa rugendo n'ubundi rudutera uburwayi nubwo dufite butoroshye.
We're still in a place where infections, is being transmitted. So really remain with the very necessary movement. So it is in that perspective that we thought that there is probably some patients who don't need to travel that long and go for chemotherapy, and patients who have been stable for a quite long period. And thinking about approaches that might get the medicine closer to them rather than them traveling to go to pick their medicine. And that's where the idea of Zipline came in.
Normally, Zipline use drone to deliver emergency blood and essential medical product to different health facilities. And we are partnering with PRH to do an instant delivery to those patients by delivering chemotherapy drug to the closest health facilities.
I'm looking forward to really grow to something that will affect even other ways of providing care. So this is, to me, this is a start, and I think we'll expand on that.
On Zipline roadmap, we are planning to expand to more than 150 health facilities. We hope to keep working with partners in health by saving time and help them to easily get products, and also minimize the risk of not getting the product on time, which can sometimes lead to health complications.
In this COVID crisis, there have been great example of solidarity. RBC provided the right leadership in terms of connecting us with the district hospitals where the patients are located. That aspect of solidarity where everyone understands the difficulty of the situation and everyone have really in mind what is the best option for the patients, and everyone is willing to make that difference, just made the things happen in a matter of few days. You can understand the stress, the fear, the uncertainty on the patients in this situation, and you can understand the joy and the hope that is created when they receive the call and tell them, listen, your package is coming in the next 5 minutes through a drone. I mean, it's a game changer.
Amazina nitwa Nyamwiza Sauda, ndi umumama w'abana babiri, mfite ubumuga bwo kutabona kuva mfite imyaka 5 y'amavuko. Urugendo rw'ubuzima nari mfite mu gihe cyashize bwambereye rubi cyane, bitewe no kuba mfite ubumuga. Hajeho kubyara abana ntafite umfasha kubarera, hazaho kutagira aho kuba, umva numva ndi mu mashimwe kuko ubuzima bwatangiye koroha nge n'abana banjye. Mwebwe rero aho muziye mu buzima bwanjye, nabonye muri mwarabaye igisubizo cy'ibibazo nari mfite. Mu by'ukuri numvaga nta herezo ry'ubuzima pe. Nkibaza icyerekezo abana banjye aho bazakurira bikanyobera, nkareba ko bazakura nk'uko nakuze, nkumva agahinda karanyishe. Ariko n'ukuri numva nshimye Imana kuko natangiye kugira icyizere cy'uko abana banjye batazabaho nk'uko nabaye. Igihe nabayeho narabuze undenganura cyari kinini. Ubu aba bantu bose bari bateraniye aha, hari abigeze guterana barutaba, ariko bataje kumpumuriza ahubwo baje kundiza. Njyewe nabayeho mbana n'abantu, igihe kiragera banteruraho inzu barayisenya barayijyana, nsigara ku gasozi. Narabitekerezaga nkumva ari akarengane gakomeye, ariko noneho ukumva ijambo rivuga ngo akarengane kabonewe umuti, nkabihuza n'abantu mbonye aha ngaha banzaniye ibyishimo, nkabihuza n'abantu baje aha ngaha mbona baje kundema no kunyubaka ngo nanjye mbeho, byangaruriye icyizere cy'ubuzima, koko mpita mbona ko akarengane kabonewe umuti. Hari ibintu byinshi byahindutse mu buzima bwanjye, nibonyemo ko ndi umuntu numva mfite umunezero n'ibyishimo, ndaryama nkasinzira sindare nshiguka ngo mu byo nahoranye nabyo, numva natwe twaribonyemo abantu kandi dufite icyizere cyo kubaho kandi tukabaho neza.
DJ murakoze. Mu buryo bwo kubasangiza aho tugeze rero, abashyitsi bacu basoje igikorwa cyo gutera igiti. Igikorwa kigezweho rero bagiye gusura exhibition mwabonye hano inyuma, iri kumurikirwamo ibikorwa bimwe mu byo dukora as PIH. Hanyuma nibava kwasura nibwo bari buze bagana mu ihema.
Our guests are concluding the tour, and we do have some of our beneficiaries who are showcasing the work that we do at PIH. So our guests will pass through the exhibition and then they will make their way in the tent shortly.
ngira ngo twabyumvishe, ubwo bagenzi bacu bagihagaze cyangwa bari inyuma twaba twegera ibyicaro byacu.
In the hills of rural Rwanda, healing began not only with medicine, but with understanding, equity, and connection. This is a story of transformation, a story of how communities that once had little access to care are now working hard to improve mental health support for all.
Mbere tutarabona amahugurwa, abarwayi bo mu mutwe twabafataga nk'ahari abantu barozwe, nk'ahari abantu bafite ibibi bakoze biri kubagaruka, nk'ahari amashitani yabateye n'ibiki byose, mbese natwe twari dufite imyumvire nk'iy'abaturage basanzwe.
Rwose pe mbere patinasi itaraza ntabwo serivisi yabagaho, abarwayi bo mu mutwe
as our guests
bakababuha abandi bakabashyira mu mapine.
Visit the exhibition. Maybe I wanted to be among the first to remind you why we are here. We are here for a celebration the 20th anniversary of Partners in Health. So I want to be the one to wish you a very happy anniversary. And I wanted to kind of acknowledge the people who have started with IMB at that time. So 20 years, it's a very long time. We appreciate your service, and thank you so much for paving the path for all of us. Happy anniversary.
Urakoze Anne. Mu gihe abashyitsi bacu rero barimo gusura ibikorwa byacu, reka tubonereho uwo mwanya wo kushimira mwese uko twahuriye hano. Imyaka 20 n'urugendo rurerure, kandi ruracyanakomeje. Reka rero dufate umwanya wo kunezererwa no kwishimira ibikorwa byacu. Turimo tunategereza ko abashyitsi bacu baza badusanga muri tent.
That's right, Bob. Thank you so much. I feel like I'm seeing some excitement. I am very excited myself, and it really is an incredible day. And I hope that everyone would have a good time. And also we need to remember that it's a time for reflection for where we've come, and also setting some goals of where we are headed, because it has really been a collective effort, and together I'm sure we will achieve much more for the years to come.
ngiye kubafasha tubazana ariko natangira babwira abantu
Hello. Abantu baba bakiri hanze reka tubasabe mwegere ibyicaro byanyu. Hello. Those who finished the exhibition, you can please walk towards your seats.
A very good morning again. As we conclude our tour, I would like to welcome our guests in the tent. And as you make your way here, please take your seat. Thank you. Turakomeza guha ikaze abashyitsi bacu abarangije gusura ibikorwa dufite muri exhibition. Twagira ngo tubakangurire kugira ngo muze muri tente dutangire ibirori byacu. Murakoze.
nukumbereza bakuza rwose bagira icumu rwogiriza uriya yanga binka we ndacyamutashye yanga binka nziza ngo nzayika umukunzi ndacyamutashye urahurahura wanga binka we ndacyagutashye wanga binka we uzongera ungabire wambaye inka y'ineza mwiturire indi nzayiragira cyane mu rwuri rw'iwacu rutoshye urugo wanga binka we ndacyamutashye uri umurangamirwa yanga binka nziza ndacyamutashye yanga binka nziza ngo irangamirwe na bose ndacyamutashye uri inkumburwa iyi nkumbuzi uwo mwiza
Good morning, Muraho. I think everyone is in a tent. We should be ready to get started. Please take your seats.
Thank you, everyone. Excellencies, distinguished guests, our incredible PIHMB team, partners and friends, a very good morning to you all. My name is Anne Nijena.
I am Bob Muhumuza. We will be your hosts for today's ceremony.
It is with enormous joy and profound gratitude that we welcome you all to this momentous occasion. The 20th anniversary celebration of Partners in Health Inshuti mu Buzima here in Rwanda, and particularly here in Rwinkwavu, where it all started. Welcome.
20 years ago, a vision was born. A vision of health equity, of unwavering commitment to the most vulnerable, and of a shared future where health is a right, not a privilege. Today, we gather to celebrate 2 decades of turning this vision into transformative reality.
Over the next 2 hours, we will take a journey through our history, hear from those who have shaped our path, and celebrate the extensive impact we've had together.
Without further ado, to formally open our program and share introductory remarks, it is our distinct honor to invite to the stage the passionate leader who guides us forward, the Executive Director of IMB, Madame Nadine Karema. A round of applause to Mrs. Nadine as she makes her way on the stage.
Muramutse inshuti mu buzima muraho muraberewe cyane mwagerageje. Today we're all inshuti mu buzima, right? It's not just IMB staff. Honorable Governor Prudence, Honorable Mayor Jean Bosco, Honorable PS Dr. Semakula, Phil Cotton, my fraternal twin, Leslie King, Board of Directors of PH Global, Madame Didi Farmer and family, the whole PIH community, good morning. It is my privilege to welcome you here where it all started. And disclaimer, you will hear it a lot today because we're so excited about the 20 years anniversary. On behalf of Inshuti Mubuzima, Partners in Health, as we're known here, I want to express our heartfelt gratitude that some of you have traveled from afar to come here, be with us, that you have walked along with us. With that, I want to thank the pioneers of Partners in Health, starting with our Umuganga Muiza, Paul Farmer, that we are celebrating even some more this week. And before I continue, I want us to have a 1 minute of silence in the memory of Paul Farmer, our Muganga Muiza, who, along with Jim, Kim, Ophelia Dell, Todd McCormick, and the board, decided to come to Rwanda. Please, let's have a minute of silence. Thank you for standing. Thank you. You may be seated. As I said earlier, all of you are Inshuti Mubuzima. All of you gathered here have played a key role in one way or another to build this. Here, I want to start by thanking not only the co-founders of Partners in Health, but also the government of Rwanda, represented here by Governor Prudence, for welcoming us to Rwanda. I want to thank the pioneers of PIH who brought with them the lessons learned from Haiti, from Peru, that include Joya that I see there, Ferney, the whole Zami La Santé team, the global team of Partners in Health, Murakoze Kiane, for all the work that you did here, that we've learned so much from you. I want to thank you. I like that I don't have to prompt you to clap. Thank you. You're such a good audience. And we didn't rehearse this. I want to also thank the former staff of Inshuti mu Buzima, represented here by our very first executive director, Michael Rich, that we've heard so much about. Thank you, Michael, for all the work that you did along the years. Thank you, current IMB staff. And thank you to our line ministry, the Ministry of Health, that keeps us in line. And that, along with the government of Rwanda, provides the trampoline on which we jump. So I want to thank each one of you for your support over the years. And last but not least, I want to thank the community of Bringwavu. Some, thank you. Most who have moved from former beneficiaries of Partners in Health to staff, to business supplier, our food supplier, to professional entertainers through the women's drummers, and on and on and on, and some who are leaders of Ready for Reading, some of the schools in the community. I want to thank you for all your support, for embracing us over the years, because you have made our work very easy. Murakoze cyane. So as you witness today, the 5S approach of PIH, the staff, the stuff, which is hard for some of us to pronounce and separate with staff, the space, the systems, and the social support, has helped us make a lot of progress in terms of delivering better healthcare and build a robust health system in Kayonza first, then in Kirehe, then in Burera, that you visited, some of you visited recently, and translating those lessons learned in new policies, new protocols that have been implemented in the whole country of Rwanda. So at the heart of any health system, the staff are very important. We are proud of the hundreds of clinical staff and more than 5,900 counting now, community health members or community health workers that we've been supporting in the districts where we work. And over the years, we've been able to implement mentorship programs and collaborate with the University of Global Health Equity to train not only the current, but also the next generation of healthcare workers. And that equipping of skills to clinical workers has made wonders, has created wonders, because we've been training the generation that will keep on treating, that is learning the philosophy of PIH, of social medicine, to treat patients better and to save lives every day. The stuff. So high quality care must have reliable tools, and that is the stuff. Together, we've helped equip hospitals, health centers, bringing technologies like the oxygen plant that you have seen, bringing the electronic medical record system that some of you championed and brought to Rwanda, and I can't forget to mention Ellen Ball, representing the HIS team here. And these tools have helped us better track the patients and bringing even more technology, saving lives, including the tiny babies that some of you have seen in the Kirehe District Hospital. The oxygen plant, the first oxygen plant that we put in Kirehe, has been available for at least 800,000 residents. So we've been saving lives, and that has been also possible because of the space that we created, the third S. So we've created space that's dignified in providing care to more Rwandans. And that means renovating maternity wards, expanding neonatal units, having one of the largest neonatal units in Kirehe district, serving even more districts. We've built the Kireye Hospital over the years. We've expanded the Butaro Hospital, district hospital, which has now been upgraded to a Butaro level 2 teaching hospital. And soon, in collaboration with the University of Global Health Equity, to be upgraded to a full teaching hospital, leveraging the presence of students. And on the fourth S, systems. We've built sustainable systems across the years. We've integrated proven models of care, being a proof of concept district, or 3 proof of concept districts in a proof of concept country of Rwanda, where we were the hub of so many initiatives. I've cited the electronic medical record system, All Babies Count, the Saving Lives at Birth, that has saved over the years and so many babies and reduced neonatal mortality by 40%. So through this collective, we've helped design health systems. We've built them, we designed them, and now we're joining forces still to maintain them and make them more resilient, especially during these hard times that we're facing. The last S, which is equally important, social support, is key, and I would say the key value addition of partners in health in this country of Rwanda. Because we believe that good healthcare is not just about clinical support. It's about being there with the people, within the wards, within the clinics, and at home with them. So with the support of this collective, our social medicine trainees provide essential services like home visits in collaboration with community health workers, mental health support, patient education. The program like the Pediatric Development Clinic is a good example of that, because it supports high-risk children, helping children with disabilities and their families. We are addressing the social determinants of the disease or of the burden of disease by having expert mothers who support and comfort the mothers of children with developmental delays. We'll help them doing breastfeeding and kangaroo care. We empower the fathers to create assistive devices for their children so that they can hit their milestone. And all of that to just empower the future generation of Rwanda. So every resource that's invested and made this program possible. Together, we've created a comprehensive model that doesn't just treat illness, but builds sustainable, equitable health systems for the long term. The work we've done together, as you've seen today, and you will see and hear from the speeches today, has already changed the landscape of healthcare in Rwanda. The future is bright, despite what's going on in the world. And as you heard today also, there's still much more to be done. And I'm confident that together we can do it. We will find innovative ways of making it despite what's going on in the world. So as we look into the future, we hope that these efforts that we've put together will touch even more communities by us bringing better healthcare to every single individual where we work and beyond, regardless of where they live and what they can afford. Together, we'll bring more teaching hospitals. We'll bring more imaging devices so that the care can be closer to the communities. Together, we'll build robust and resilient health systems. And I know that through the loyalty and commitment of this community, we can do it together. We have already transformed health, and we'll continue transforming lives. Murakoze cyane.
Thank you so much, Nadine, for those incredible words of wisdom that truly set the tone of today's celebration. Please, ladies and gentlemen, allow me to give a brief summary in Kinyarwanda to our non-English speakers. Muranyemerera tugendeye ku byo umuyobozi avuze ndavugamo bikeya. Yatangiye ashimira guverinoma y'u Rwanda kubwo ubufatanye twagiye tugirana muri iyi myaka ishize. Yashimiye abashyitsi bakoze urugendo rurerure baza kwifatanya natwe muri ibi birori byo kwizihiza imyaka 20 tumaze nk'umuryango inshuti mu buzima. Yanashimiye abashinze umuryango inshuti mu buzima abavuze mu mazina. Ikindi by'umwihariko yashimiye abakozi b'umuryango inshuti mu buzima bari hano, ndetse yanavuze bamwe mu batangiye harimo n'umuyobozi mukuru wa mbere w'umuryango inshuti mu buzima mu Rwanda. Ikiganiro yatugejejeho cyane cyane yagarutse ku byo twita 5S's, arizo zivuga ku bakozi, ku bikoresho, systeme z'ubuzima, ndetse anavuga no gutanga ku bufasha bw'ibanze. Yongeye avuga cyane ko dutewe ishema n'abakozi, abakozi ba Partners in Health, abaganga, abajyanama b'ubuzima bagize uruhare rukomeye mu gushyira mu bikorwa imishinga itandukanye twagiye dukora nk'umuryango. Kandi iyo mishinga twagiye dukora ikagenda inagenderwaho mu gufata ibyemezo ku rwego rw'igihugu. Yavuze ku bikoresho cyangwa ibyo twagiye tugeraho, cyane cyane atinze kuri EMR system. Yavuze ku bijyanye n'uburyo twabashije kubaka ibitaro. Yabavuze uburyo twagiye duherekeza ibigo nderabuzima. Yavuze ku bijyanye n'amahugurwa twagiye duha abajyanama b'ubuzima ndetse n'abandi. Muri byinshi bitandukanye yavuze ko mu mukoro ukurikiraho ni ukugira ngo tubashe kubungabunga ibyo twagezeho mu byiciro bitandukanye. Ahazaza ni heza, nicyo kintu yagarutseho asoza, tutitaye ku bibazo biri mu isi. Rero turifuza ko mu hazaza tuzakomeza gukorana neza, tukubaka za systeme z'ubuzima, tugakomeza tugafasha abarwayi, kandi tukazana n'ibindi bikoresho bitandukanye bidufasha kuvura abarwayi neza. Murakoze cyane.
And now, like they say, a picture is worth 1,000 words, but a video, well, that tells a whole story. We've been working tirelessly for 20 years, and it's impossible to capture it all in a few speeches. So prepare to be moved, informed, and inspired as we take a look back at our journey, the lives we've touched, and the challenges we've overcome through this special IMB documentary.
Tugiye gukurikira amashusho agaragaza muri bimwe twagiye tugeraho nk'umuryango inshuti mu buzima. Hari amateleviziyo ari imbere yanyu, niyo turi bugukoreshe mu minota 10 iri imbere kugira ngo tubashe kugira ishusho y'ibyo twagezeho. Murakoze.
Story yanjye na PIH navuga ko nahujwe nayo n'ikibazo nari mfite cy'ubwandu bw'agakoko gatera sida, kuko icyo gihe PIH iza hano muri 2005 baje bashaka nyine abantu bababaye bafite ibibazo by'uburwayi burimo HIV, burimo n'igituntu cyane cyane n'izindi bazirebaga, ariko izo cyane cyane nta miti yahabaga. Baje rero baje kudufasha mu kubona imiti, ndumva hari mu kwa 4 kwa 2005. Nicyo cyaduhuje n'umuryango inshuti mu buzima.
I remember it like it was yesterday, I had visited Rwanda to have a look at where PH might be working. I was not the first person from PH to visit Rwanda. Dr. Joya and Paul had been there, but I came over and was introduced to and driven to Ringwavu, and it was there that there was really an abandoned hospital, very little infrastructure there. And I remember going and spending time talking with the district, one of the district nurses there. And it was an exciting time because we saw just how much and how committed Rwanda was to really rebuilding and building a robust health system.
Hatangiye amasensibilisation twerekana uburyo HIV ishobora kuvurwa. Abarwayi bakomeje batubana benshi, ugasanga abo twazanye, abizanye, abo twagiye gukura mu mazu, cyitwaga ibitaro kitaraba ibitaro neza, hataravugururwa, bamwe byasabaga ko baryama no hasi.
Naje kugira ikibazo cyo kurwara cyane niko nabivuga, nta nibiro abantu barahabaye baramfasha, ku buryo navuga ko iyo ntaza kubagira icyo gihe nanjye nshobora kuba mba ntakiriho. Icyo gihe ni muganga Paul Fama wankurikiranye, abwira inshingano n'abasosiyale kugira ngo bashore kureba no mu buzima busanzwe uko mbayeho. Icyo gihe ndibuka ko amvura yari kumwe na hospital niwe wari nk'umutranslate icyo gihe, barankurikirana bankora ibishoboka byose, baramfasha barankansuringa, bituma ya eta mbi nari ndimo nyivamo.
PH Rwanda started in Ringwavu, which is in the eastern province, and then through the success that the HIV/TB intervention had, and given that it's close to the district of Kirehe and many patients were coming such a long way to seek care in Ringwavu, the Ministry of Health requested that PIH expands to Kirehe, and then 2 years later to Burera in the northern part of Rwanda. Then we started seeing some of the patients suffering from non-communicable diseases. Then we also saw some patients suffering from mental health. So with PIH seeing within the areas where we serve, seeing so many patients coming with symptoms of the disease, we decided that we had to take action and making sure that just like for HIV, TB, NCD, PDC, the patients don't think that they have to go to the capital city.
PDC ikintu nahigiye ko nahuraga n'abandi benshi bafite umwana nk'uyu wanjye, gutyo twagendaga tuganira, buri wese akakubwira ikibazo cye n'undi akakubwira ikindi ikibazo cye, byatumye twese twiyumvanamo. Noneho abana bacu akakubwira ati ujye ukora ibi, akakubwira ati namwe ati akenshi ujye umwicaje mu ibasi umutega imyenda, ugenda umuhindura umwubike, ibintu nk'ibyo nyine twese twigishanya ikintu wakorera umwana wawe. Rero PDC ikintu yadufashije twese mu babyeyi ni ugutinyuka.
Iyo nabyumvaga hanze abantu bavuga ngo diabete ni indwara mbi, numvaga ko mfite nanjye guhita mpfa. Ntarahura na partners in health, nari mfite imbogamizi yo kubura ibikoresho byo kwipima, gufata imiti hato na hato nkabura amafaranga yo kuyishyura, ariko ubu ngubu partners in health irabiduha, n'imiti kandi dufata ni ubuntu, ntabwo tuyishyura, n'ibikoresho baduha ni ubuntu.
The Butaro Center Cancer of Excellence was the first cancer center like that in a rural setting in Rwanda.
Natangiriye muri za Butaro nivuza kanseri y'ibere, banterwa imiti z'inshinge, banyandikira n'ibinini nshoje kubagwa, hanyuma aho nshoreje iyo miti banyohereza gushiririzwa muri Kanombe. ubu ndiyo ndashiririzwa.
In order to address the holistic care of patients, it's not just about the medicine that you give, but also knowing whether they have the social support at home, they have the economic support, which is, includes food to eat, includes having proper housing, includes, having the facilities or the means of coming to seek care.
The enhancement and expansion of Rwanda Hospital, but the building of Kurehe Hospital, and then the building and expansion of the district hospital in Butaro. These are enormous undertakings.
With PIH, it's been about we innovate, co-create the innovation with our partners, which are the Ministry of Health, with input from our other partners who are our patients and communities. Then we implement, document, learn lessons, and disseminate those lessons learned. And with so many lessons learned, we had to share them with the world, or at least make sure that the next generation of healthcare providers apply those lessons and keep learning from them, keep learning from the implementation work that Partners in Health was doing in Rwanda. And that's how UGHE, the University of Global Health Equity, started.
Paul and I would WhatsApp multiple times a day, as he did, I'm sure, with many of you. And he was so joyful in his last weeks, telling me every day of interactions with all of you and with the patients. He was so proud of what was happening here, and also IMB is such the heart in many ways of PIH in really striving for excellence in clinical care, which was so important to Paul.
I think this anniversary is about celebrating our work, especially the people behind the work, the people that we call partners in Health, which is the staff, the patients, the communities, looking at how far we've come and knowing how much we've achieved through our 5 S's approach is a big deal for PIH. And that is why the theme is about celebrating impact, celebrating holistic care, celebrating the efforts that we've made through equity.
Nkaba barimo gushimira patenasi n'ubufatanye bwa leta y'ubumwe ndetse na muganga wanjye Steven Rutegera n'umukuru w'igihugu Paul Kagame. Ndabashimiye intambwe mwateyeho kudukura mu mworero.
Uvuze ngo mu myaka 20 wageze ku kintu nakubwira ngo sinageragaho kuba narahabonye mfite akazi. Ikindi muga mu myaka 20 nuko hari benshi atari je jenyine bashoboye gusimbuka urupfu kubera umuryango inshuti mu buzima ubu bakaba bameze neza.
I can't believe how lucky I am to have worked in this country over the last 20 years and to have seen personally how much healing could happen. And as I finally confessed publicly here, I didn't really know that was possible when I came here the first time. But now I know. Now I know it's already happened.
I want to say congratulations to all of you at IMB for this milestone of 20 years of work. What an extraordinary set of accomplishments that all of you are responsible for. And I am looking forward to many more years of visiting IMB, bringing people to visit the work that you're doing, and I won't stop. So thank you. Morokoze Chani. Akazi Keza.
Wow.
That was truly powerful. It reminds us why we do what we do and the incredible human right that drives our mission.
Yeah, that's right, Bob. I will now be interpreting. I will not be interpreting because we had subtitles. But what I can add is that we heard from the patients, we heard from our founders, we heard from current PIH staff, and again, they talked about, they gave stories of impact focusing on our flagship programs, but I need to highlight that that is, I take that as a very small drop in a big ocean, because what we have done in the past 20 years, they are much more than what a video can capture. Those stories, again, the stories of impact, the stories of hope that you just witnessed in a video, they are part of a large global movement for health equity that is spearheaded by our leadership at Partners in Health Global Office.
To share from the global perspective and to speak to the enduring partnership between PIH Global and IMB, we are honored to welcome the PIH Global representative, Leslie King. Leslie King has been a board member at PIH, at Partners in Health for 14 years, and currently she serves as the chair of the board. Welcome to the stage, Leslie King.
Thank you. It's my honor to meet you, to greet you this morning with a warm Meramutse Neza. I'd like to acknowledge and welcome the Honorable Governor of the Eastern Province, Prudence Rabingiza, the Honorable Permanent Secretary of the Minister of Health, who also represents the Minister, dear Mayor of Kayonza, dear Director General of Hospitals here presents, dear Madam Dee Farmer, dear Executive Director of IMB, and our own Vice Chancellor of the University of Global Health Equity, all protocol observed. Thank you for being here today. My name is Leslie King, and I'm honored to be joining you not only as a longtime supporter of this incredible work, but also in my new role as chair of the Global Partners in Health Board of Directors. It's a privilege to greet you on behalf of the board as we come together to celebrate the 20th anniversary of Nshuti Mu Bazima, collaboration with the Rwandan Ministry of Health. 20 years ago, I made my first trip, my first journey to Rinkwavu, as a new supporter of this extraordinary work. The hospital had just been renovated, and I remember the atmosphere so clearly. Staff welcoming patients with a sense of urgency and optimism and hope. From the beginning, our focus was clear: to equip the hospital with the 5 S's, as Nadine just so beautifully went through: staff, supplies, space, systems, and social support. We needed that to have this hospital come back to life as a center for healing. I'll never forget walking the halls with Dr. Paul Farmer, listening to him talk with such passion about the feedback loop, the essential interplay of service, teaching, research, and advocacy. That lesson has stayed with me ever since. When I returned a year later, the operating room was fully functioning and plans were already underway for a second. What struck me most in those early days was the dedication of the staff, many of whom are here today. Even before the official training center opened, learning and mentorship was happening in the halls, setting a new standard for what excellence and care could look like. And today it fills me with pride to see a new generation of clinicians and staff leading the way, caring for every patient who walks through these doors with skill and compassion. Reflecting on those early days reminds me of how far we have come and how much we have grown together. We have always worked to meet the immediate needs of patients while also building something lasting, transformational systems, evidence-based practices, and a culture of continuous learning. None of this would have been possible without the extraordinary partnership between the government of Rwanda, IMB, and the Global Coordination Office of PIH. Together, we have created a model that is recognized across the globe, a model rooted in health equity and human dignity. That spirit of possibility has extended far beyond Rinkwavu. From Karehe to Butaro and beyond, you've continued to prove what's possible in places where others said it couldn't be done. I think of Butaro District Hospital and the Cancer Center of Excellence, how much we've learned from that work, and how many lives have been changed. And I think of the University of Global Health Equity, now preparing the next generation of leaders who will carry this mission forward. And we remember that UGHE's first cohort of master's students trained right here in Rinkwavu before the Butaro campus opened. Yes, that's amazing to think back. I had the opportunity and the honor to meet with your Honorable Minister of Health this week, and we discussed our shared accomplishments. Together, IMB and the Rwandan Ministry have built an expanded Butaro hospital that is now designated as a level 2 teaching hospital, really quite extraordinary from the place that we started. We also established the MESH mental health program and the Pediatric Development Clinic. And from the beginning, we have been accompanying the government to scale up community health and NCD care. At the root of all of this work is the health system strengthening enablers, which include things like an advanced lab, biomed, MESH QI, AMR stewardship, infection surveillance. These specific enablers, along with the 5 S's that we implemented, have remained priorities for PIH IMB Global for the model as we accompany the Minister of Health in continuing to link service, delivery, training, and research. As we look to a future filled with more unknowns than knowns, PIH is committed to continuing to demonstrate that what is deemed possible in healthcare delivery is indeed possible. We see the current changes in the global funding landscape as an opportunity to infuse future health financing mechanisms with the principles of social medicine. By building on our theory of change, PIH seeks to deepen our impact over the next 10 years by leveraging successful models. And we can't do this alone. It is partnership that makes this work. I want to offer my deepest appreciation to each and every one of you who has contributed to this journey. Every year, more patients are treated, care improves, new services are introduced, communities grow stronger. That's because of your unique talents, your unwavering dedication, and the power of our collective effort. I have to shout out to our South by South partnership, which was starting this effort. We have many Haitian colleagues here with us today who were here on these grounds and started a lot of this work. We appreciate your guidance and also your involvement all the way from the beginning and your involvement today. And of course, we also have enjoyed the Pan-African partnerships with colleagues from our other PIH sites, many of whom are here today in Sierra Leone, Liberia, Malawi, Lesotho, coming to Rwanda to share best practices. On a personal note, I continue to be moved by the courage and compassion I witness here, seeing lives saved, families restored, and hope renewed, especially for those who are too often left behind. It reminds me why this work matters so deeply. You have not only built a stronger health system, you have built something far greater, a legacy of dignity and possibility that will endure for generations to come. Here's to the next chapter in this powerful story and to continuing this journey together. Marakoze Chane, thank you so much.
Thank you so much, Leslie King, for those words of encouragement. Ladies and gentlemen, please allow me again to give a small summary of what the board, the chair of the board just highlighted. Umushyitsi mukuru umaze kutuganiriza ahagarariye inama nkuru y'ubuyobozi bwa Partners in Health ku rwego rw'isi. Yatangiye avuga uburyo serivisi dutanga ndetse n'uburyo twigisha ndetse tukanavuganira abarwayi aho bihurira. Yavuze uburyo mu minsi ya mbere batangira yajyaga aza akabona uburyo twakirana abarwayi impuhwe by'umwihariko abaganga. Buri gihe twakoraga tugendeye ku byo abarwayi bakeneye ako kanya, ariko tunakora ibishoboka byose kugira ngo ibyo dukora bigerweho dukoranye na guverinoma ndetse na Partners in Health ku rwego rw'isi. Yongeye agaruka kuri kaminuza yigisha iby'ubuvuzi y'Ibutaro, aca umurongo ko abanyeshuri ba mbere bo mu cyiciro cya gatatu cya kaminuza Masters Program batangiye kwigishirizwa hano i Rwinkwavu. Ku bijyanye n'icyerekezo dufite, yavuze yuko ibyagezweho nka Partners in Health ntago byari kugerwaho tutabashije gukorana na guverinoma ndetse n'abaturage ndetse n'abaho dukorera. Mu hazaza mu myaka 10 tugambiriye kurushaho gushyira mu bikorwa modeli zo gutanga ubuzima tuzi ko zikora neza kandi tuzi ko zizana impinduka kuri systeme y'ubuzima. Murakoze.
Our success would be impossible without the remarkable collaboration and support of the local governance.
Kayonza district, which is where we are seated today, has been fundamental to our service and impact in Rwanda. With unwavering support from the leadership, Partners in Health Inshuti mu Buzima has been able to leave a mark to the lives of the patients, the community, and meaningfully accompany health facilities and health providers in our collective quest for health equity. It is with a great recognition that we welcome the esteemed mayor of Kayonza district, Mr. Nyemanzi Jean Bosco, to share his highlight for today. Please join me in welcoming the mayor.
I will start with a small correction of my name. It is not Nyemanzi, it is Nyemazi. Mwaramutse mwese muraho. Twishimiye kubakira mu karere ka Kayonza. Uyu munsi turimo kwishimira ibyo abafatanyabikorwa bacu bagezeho bafatanije n'ubuyobozi. Ku nyungu z'inshuti zacu zatugendereye, muze kunyemerera numvishe dufite ba MC beza, nze gutanga ubutumwa bwanjye mu rurimi abashyitsi bacu badusuye bumva, ubwo MC wacu araza gukomeza kudufasha. Honorable Governor of Eastern Province, Mr. Pidansi Rubingisa, Ms. Farmer, Mrs. Farmer, Leslie King, Chair of the Board of Directors, Global Partners in Health, the Executive Director of Partners in Health, Nadine Karema, sorry, I was collecting my name while I was planning to. Nadine Karema, the Vice Chancellor of University of Global Health Equity, Dr. Philip Cotton, distinguished guests, all protocols observed. It is a great honor and joy that we are gathered today to celebrate 20 years of Partners in Health, impact in transforming lives, but of course celebrating 31 years of transformative and visionary leadership of His Excellency President Kagame. It is because of such a leadership that there is a very good working environment to have good partners and be able to collaborate with government and all stakeholders to have the achievements we are celebrating today. 20 years means a lot. It is a celebration of progress and incredible partnership that our government, especially here in Kayonza district, we have had with Partners in Health. This celebration holds special meaning for us. It was here in Kayonza district, right here in Rwanda where we are, that the Partners in Health journey in Rwanda began in 2005. Since then, we have witnessed a powerful transformation in the way care is delivered, especially for our most vulnerable citizens. This has been possible because of robust investments by the government of Rwanda in the healthcare systems that has also allowed various partners to join in and work together to have all this that we are celebrating today. What makes PIH truly unique is not just medical care it provides, but the holistic approach it embraces. From building houses, providing food packages, I want to mention something very special here in Kayonza, especially Rwanda Hospital. And from the philosophy that food is medicine, our patients here who come for health care and medical support were able to get good food that complement the medical treatment. We have seen some transformative community projects, creating some income generating activities. You have seen some of them here as we're entering the fish ponds, helping communities pay school fees, addressing human security issues, that construction of the needy communities. Reminds us that health is not only about hospitals, but also about dignity, equity, and opportunity. We want to appreciate the good collaboration and partnership with Partners in Health. Inshuti Ubuzima stands a unique organization that embraces the transformative philosophy of what I just mentioned, food being a medicine. A vision championed by our beloved Dr. Paul Farmer. This innovative approach recognizes that healthcare extends far beyond clinical treatment to encompass the fundamental human needs that impact health outcomes. Community work. I have had the profound privilege of witnessing and working alongside Dr. Paul Farmer in his groundbreaking community health initiatives. I remember early 2022 when we were here with Paul Farmer distributing mobile phones to community health workers that would help them deliver well in their services and capture data related to healthcare services. It is, of course, beyond clinical treatment, but to more empowering lives. It is also important as we celebrate to look forward. I address this, of course, to Leslie King, the chair of the board, and all the partners present. While we celebrate the remarkable achievements we have accomplished together in the last 20 years, our journey is far from complete. We remain committed to expanding our impact and enhancing the quality of healthcare we provide to our communities. Our immediate collaboration priority is the strategic expansion of both OPD and surgical services at Rwanda Hospital to improve patient flow and reduce waiting times and continue to improve the service capacity to serve more patients effectively. I remember we had 3 groups in the morning that visited different areas. I was with the Honorable Governor and the Honorable PS, among other guests. Among other things that were discussed was the expansion of the OPD expansion for more services. And I know we've been in the discussions of the pending projects of OPD expansion. This is an area that we need to reflect and ensure we can implement together. Today, as I come to conclusion, as we celebrate 20 years of service, we also look ahead. We reaffirm our commitment to continuing this strong partnership, and we invite all of us to keep investing in equitable, people-centered care, especially in rural areas. One may think that the services are limited to this hospital, but there is also a big catchment area that involve around 9 health centers and more health posts. That means increasing investments in health posts, and of course appreciating the partnership in supporting the technical support of staff who have also contributed much on this. On behalf of the people of Kayonza, I say thank you. Thank you for believing in our communities. Thank you for working with us on this journey, and congratulations on 20 years of impact.
Thank you so much, Mayor Nyemazi. Again, allow me to give another Kinyarwanda interpretation for non-English speaker. I will be straight to the point. Yagerageje kuvuga ku munezero mwinshi dutewe no kuba tumaze imyaka 20, ndetse anongera kuvuga ko hari indi myaka 31 tumaze dufite ubuyobozi bwiza muri iki gihugu. Rero ubwo buyobozi bwiza nibwo bwatwemereye ko tubasha kumara iyi myaka 20 turi gukorera muri iki gihugu. Kuba twizihiza rero isabukuru y'imyaka 20 bivuze ikintu gikomeye kuri Kayonza, kubera yuko habaye impinduka zifatika ku buryo ubuvuzi butangwa. Ikigira Partners in Health umwihariko si ugutanga ubuvuzi mu bitaro gusa, ahubwo ni ukubaka amazu, tukayubakira abatagira shinge na rugero, tugakora n'ibikorwa bizamura ubukungu bw'abaturage. Ubuvuzi ntabwo ari ibitaro gusa, ahubwo ni agaciro, ni ukuzamura umuturage, ni no guha amahirwe abaciye bugufi kurusha abandi. Mu hazaza rero nk'akarere ibyo babashije kudusangiza bifuza ko turushaho gukorana, ni umukoro yahaye ubuyobozi bukuru bwa Partners in Health. Yavuze yuko ibyo twagezeho ntaho biragera, turacyakomeje urugendo. Rero bifuje ko dukomeza gufatanya mu kurushaho kunoza serivisi z'ubuvuzi zihabwa abantu bivuza bataha. Bafite umushinga wo kwagura department ya OPD. Asoza yavuze ko kurushaho guteza imbere ubuzima, yavuze ko dukomeza gukorana nabo mu gutanga ubuvuzi bushyira imbere umurwayi. Ubwo ni cyo twita people centered care, kandi tunazirikana ko Kayonza ni akarere kanini. Murakoze.
Yeah, it's now a tremendous honor to invite to the stage the Permanent Secretary of the Ministry of Health, Mr. Dr. Mohamed Semakura. Dr. Semakura is a health system leader and a scientist who has spearheaded impactful research and innovation across the country. Dr. Semakura, please welcome to Ringwavu, and the floor is yours.
Okay. Reka nsubire muraho. It's a great pleasure to be here, dear Governor of Eastern Province, dear Leslie King, the chair of board of the PIH, director, mayor of Kayonza district, Nadine, executive director of PIH, vice chancellor of Global Equity, Madam Dee Farmer and the family, all protocol observed. It's a great pleasure to join today celebrating 20 years of commitment, compassion, and impact. On behalf of Minister of Health, I extend congratulations to the partners in health, Inshuti mu Buzima, on this milestone. Since 2005, PIH has been a trusted companion of Rwanda health system. We had a long journey with PIH in terms of transforming the health system, but also, most importantly, saving lives of people. You have seen the testimonial from the video. Together, we have worked to inclusive decentralization of the health system. The approach of decentralizing system from community and now leading to the specialized services. It's a long journey that we couldn't make without your great collaboration. But also, though the PIH operates mostly in 3 districts, but their impact is bigger than that. We work together on their basis. We share evidence and the fact. All the procedures that we use are more evidence-based. We work through different platforms to ensure that the best practice that the PIH has done can be extended to other areas in the country, but also we know it goes beyond. It doesn't only operate in Rwanda, but globally. We have seen Rwanda Hospital District becoming a pillar of high quality care in non-communicable disease, mental health, and also surgery. We have seen Kirehe District, where we saw the first excellent center of maternal, newborn, child, and adolescent health, including also supporting the refugees that are in this catchment area. That is a great contribution to the country, but also to the beneficiaries of those services. Butaro District in Burera, we have seen how it was transformed from the first level hospital at level 2 teaching hospital and National Rural Center Excellence for Cancer Care. This is a unique model. Beyond those districts, we have seen also how PIH helped to scale up the proven approach, mainly in pediatric development clinic, cancer screening effort, as well as in other parts of country where we are using those best practices. Together, we have made a meaningful stride to build a more resilient, equitable health system to all levels of care. With PIH, we're able to renovate neonatal surgical facilities in hospital, strengthening diagnostic capacity. National health referral centers were supported to identify the space equipped with high quality care. The health professionals at all levels, from the community health workers to the cancer care specialists, have benefited from the tailored training and ongoing mentorship across all levels of service delivery in this country. Whether by expanding access to cancer diagnostic or treatment, or advantage on maternal mental health child programs in rural area, BREDA is a partnership has helped to bring essential care closer to the people, mainly those who are in need. And that is a tremendous achievement that we are celebrating today. We have seen also partners in health collaborating with us during emergency response, not only limiting on the services, but also during COVID, during Marburg, we were together to respond on outbreak, to protect our staff who are on front line, as well as saving life of patients. We have seen partners in health on their visionary leadership, creating the University of Global Health Equity. Stands as a powerful example of our commitment to cultivating a new generation of health leaders grounded in equity and social justice. Those contributions reflect the system-wide collaboration, strengthening care at the community levels while also reinforcing institutional at national scale, establishing a university that is a great vision that's showing the sustainability. We have also seen the approaches. It's not only that PIH does things, but how they do it. It matters, and it can bring some value added. So this model of accompaniment, working with patients through every challenges, mirrors our national vision, a health system rooted to the compassion and the dignity. Also addressing non-medical barriers to care, like nutrition, stigma, but also distance to ensure that the care reaches everyone, especially the most vulnerable people, is very key and important. As we reflect the 20 years, we also look ahead with a renewed determination. Ministry of Health remain committed to work closely with partners in health, all partners, to advance universal health care coverage, decentralized and specialized services, ensure equitable and high quality care for all. In the past, the infectious disease was the main leading cause of death. Currently, we are seeing a change in terms of trend, where non-communicable disease is leading. But now, we don't have only infectious disease, but now we have both infectious disease and non-communicable disease. It's time to put much effort. It's not time to relax, because we have now double burden of disease. So let this anniversary not only honor the past 20 years, but also try to ignite our collaborative ambition in coming years. In line with the Ministry of Health priorities, mainly on workforce and clinical excellence, I call on us to all around two main areas that we're still struggling. The first area, we are requesting to collaborate, to partner with all of us, to have these three hospitals, Butaro, Rwinkwavu, Kirehe, became full level 2 teaching hospital with the capacity, having the training residents, specialized care at the heart of the community that needs services. Second, Butaro Cancer Center, let's work hard to make it truly a comprehensive hub that offering spectrum of cancer diagnostic, treatment, and care under one roof. We call all our partners to work together as we have been doing it, but this time we need more collaboration than ever. Let's come together, mobilize resources, mobilize to sustain the strategic financing, to provide long-term support, and also sustain what we have achieved so far. Muganga Mwiza wanted this to be a dream. We can't disappoint him. We will continue to make sure that those in need are accessing services. I'll take this opportunity also to thank all the staff of PIH, the colleagues that we spend much time together in this journey. Congratulations for the great work that you are doing under the leadership. We are looking forward to continue together. Murakoze cyane.
Thank you so much, Dr. Semakula, for those powerful words. Munyemerere nongere mvuge mu Kinyarwanda. Dr. Semakula niwe munyamabanga uhoraho wo muri Minisiteri y'Ubuzima. Yavuze yuko Partners in Health yabaye umufatanyabikorwa wizewe wa Minisiteri y'Ubuzima. Mu byo twakoze yagarutse kuri byinshi abandi bagiye bavugaho, ariko yanavuze ko twatanze ubuzima kandi twabashije kumanura serivisi z'ubuzima z'ubuvuzi tuzeregereza abaturage. Mu byo twakoranye ashima cyane nuko twabashije gukoresha ubushakashatsi cyangwa kubasha gukora kwifashishije amakuru kugira ngo tumenye ibyo dukora neza turusheho kubikora. yavuze yuko mu turere twose dukoramo hagiye habaho impinduka zifatika kandi Minisiteri y'Ubuzima ibyo byose yarabibonye. Yavuze ku bijyanye no guha ubushobozi abakozi b'ubuzima duhereye ku bajyanama b'ubuzima ndetse no kugera ku ba specialist. Partners in Health yagize uruhare rukomeye mu gufasha igihugu mu guhangana n'ibiza twahuye nabyo harimo ikiza cya COVID ndetse n'ikiza cya Marburg. Ubufatanye twagize ni ubufatanye bwagutse ku rwego rw'ubuzima harimo no kwigisha abaganga ndetse no guherekeza umurwayi no guhangana imbogamizi nyinshi zikunze kugariza abarwayi iyo bashaka gukurikira serivisi z'ubuvuzi. Ibyo bifuza ko twarushaho gutekereza barifuza ko ibitaro dusanzwe dukorana nabyo turusheho byose kubishyira ku rwego rw'ibitaro rwigisha kandi ibitaro byujuje ibisabwa byose. Yavuze ku bitaro bya kanseri by'ibutaro aho avuga ko ku rwego rw'igihugu bifuza yuko serivisi zose zivura kanseri bifuza ko zajya zitangirwa ahantu hamwe. Dukeneye kurushaho gukorana kandi byimbitse kugira ngo tubungabunge ibyo twagezeho. Murakoze.
We've been sitting for quite a while. It's time to celebrate the vibrant culture that binds us all together and the spirit of community we serve. We are incredibly fortunate to have with us today a talented culture troupe that will share a performance that embodies the joy, resilience, and beauty of Rwanda. To give a bit of background about this community troupe that is going to entertain us. The troupe consists of beneficiaries of our economic empowerment initiatives. They used to be patients, caregivers, and have formed a dance troupe. What a great example of transformation. Please join me in giving a massive round of applause for the incredible Nyangora Kids troupe. Tap your foot, clap along, show genuine enjoyment. This is a moment of culture appreciation and celebration.
Karibu Nyangora troupe muze mudusangize ibyishimo. Ikindi nagira ngo mbibutse ko aba bantu bagiye kutubyinira bamwe bahoze ari abarwayi abandi bahoze ari abarwaza ariko ubu ngubu bakubishyize hamwe babasha guha abandi ibyishimo n'urugero rwiza rw'impinduka zishobora kubaho. Ni karibu groupe ni muze mudufashe kunezerwa.
dushegeye turirimba twese duhimba ingeri z'abahizi z'u Rwanda twambariye gutsura cya kivi cy'abakara dusengeye turirimba twese duhimba turingiye ingeri z'abahinzi b'u Rwanda twambariye gutsura cya kivi cy'abakambwe muze twizihirwe baturora twimikuye umuco wacu utazava ucika tuzanye inkubito y'ikeza n'ishyaka ry'amarere twitabira imihigo dusengeye turirimba twese duhimba turi ingeri z'abahinzi z'u Rwanda twambariye gutsura cya kivi cy'abakambwe wanda witera ryo ngoya bishobora kana ku mugongo wanze kugaramera nibuka mwafuye nibuka no abahanzi mureke yabaye tuzanye inkubito y'ikeza n'ishyaka ry'amarere twitabira imihigo kare bari rwose watatarabye rusakara nibaze ko mu bacu dusengeye turirimba twese duhimba ingeri z'abahinzi z'u Rwanda twambariye gutsura cya kivi cy'abakambwe patirari ni hafi imyaka twimikuye umuco wacu utazava ucika tuzanye inkubito y'ikeza n'ishyaka ry'amahere twitabira imihigo dusengeye turirimba twese duhimba ingeri z'abahinzi z'u Rwanda twambariye gutsura cya kivi cy'abakambwe dusengeye turirimba twese duhimba ingeri z'abahinzi z'u Rwanda twambariye gutsura cya kivi cy'abakambwe wogera patinasi ni heavy imyaka 20 yose umaze uranze ubaye bukombe guma hole abiwacu abaturutse i Rusizi abiwacu muraho abafurika y'epfo abiwacu muraho intore za Kayonza abiwacu muraho abaturutse i Nyankora abiwacu muraho ndetse n'Afurika y'epfo abiwacu muraho abaturutse Nyamirama abiwacu muraho abiwacu muraho abiwacu muraho yego we abiwacu muraho guma nguna agateganeza kandi abatanze n'agateganeza ngagatabaro
patinazi wahoze kandi
kugenda patinasi imyaka 20 yose umaze uranze ubaye bukombe
turashima patina we
patinasi
abaganga waduhaye amashuri
turashima
waduhaye byose maze umberange
turashima kandi uzaruriho imyaka 20 maze waduhaye ubuzima none ubu turishimye turashima
waduhaye ababyeyi waduhaye abana
turashima
waduhaye ubuzima none turishimye
turashima patinasi wahozeho kandi uzahoreye imyaka 20 umaze waduhaye ubuzima none turihimye turashima
abaganga waduhaye byose
turashima patinasi wahozeho kandi uzahora uriho imyaka 20 umaze waduhaye ubuzima none ubu turishimye turashima
tumaze inzara none ubu turishimye
turashima turashima patanasi wahozeho kandi uzahora uriho imyaka 20 maze waduhaye ubuzima none ubu turishimye turashima turashima patanasi imyaka 20 yose umaze abantu bawe urukundo patanasi wahozeho kandi uzahora uriho imyaka 20 maze waduhaye ubuzima none ubu turishimye turashima
icyizere none ubu turishimye
turashima patanasi wahozeho kandi uzahora uriho imyaka 20 maze waduhaye ubuzima n'ubu turishimye turashima Marikana ku mugongo wanze kugaramira ko Oh, no.
Thank you so much to the community troop. Let's give them another round of applause. I also have to highlight this. We did not hire these people. These are the members of the community of Rwingwavu, who have come. They are the kids. Some of them have benefited from our interventions in one way or another. Unfortunately, the songs are in Kinyarwanda, but it's a beautiful song. All they had to share is gratitude. You could see it on their face, the smiles, but also the words really are so meaningful. They are saying that PIH was here, and they hope that it will continue to be here. They are grateful that it has given them the hospitals. It had saved their lives. It had given them mothers, live mothers, and children, and they are happy and they are very grateful. Isn't that beautiful? And let's give it a hand because it's really beautiful hearing it from the people with lived experiences and the joy they shared with us. It was just incredible. Thank you so much, Greenwave community, for sharing in with us throughout these past 20 years and that you allowed us to be here. And thank you.
Thank you, Anne. We've had incredible stories, seen powerful images, witnessed examples of impact for the exhibitions, and felt the immense spirit of collaboration at different levels. Now, to cap up our formal remarks, we have the distinguished privilege to welcome our guest of honor, the Governor Rubingisa Pidance, the Governor of the Eastern Province. Ladies and gentlemen, join us in giving a warm Rwandan welcome to our esteemed guest of honor.
The Permanent Secretary of the Ministry of Health, Dr. Semakula, Mayor of Kayonza District, Didi Beltran, Farmer, and the entire family of late Farmer, Leslie King, the Chair of the Board of Directors of PIH Global, Professor Cotton, the Vice Chancellor UDHE, Nadine, CEO of PIH Rwanda, distinguished guests and partners, friends and guests, all protocol observed. Good afternoon. It is both an honor and privilege to stand before you today as we celebrate a remarkable milestone, 20 years of unwavering partnership, compassion, and impact through Partners in Health Rwanda, well known as Nshuti Mubuzima. Let me begin by expressing a warm welcome to all of you gathered here from across Rwanda, and especially those that have come from abroad, and again to our partners in the health sector who have also joined and worked hand in hand with the communities across the Eastern Province. As we've been told, they have been operating in different districts and also providing wonderful health services to our people. This is more than actually an anniversary. This is a celebration of what is possible when values meet action, when expertise meets empathy, and when global solidarity meets local resilience. It is all begun right here in Rwingwavu, 20 years down the road, in the heart of Kayonza district. Yes, we need to. In celebrating 20 years of impact, allow me to recall that in 2005, Rwingwavu was a place still recovering from the deep scars of the past, and access to healthcare was really a daily struggle. I think the communities here and even those surrounding Rwingwavu can testify this. Hope was really fragile. But with the arrival of Partners in Health, in partnership with the government of Rwanda and the Ministry of Health, a new model of care took roof here. a model rooted in dignity, a model that refused to accept the poverty should ever be a death sentence. We've seen testimonies, we experienced the joy, the people that have expressed again kind of enthusiasm, the smiles from the sickness, but also to the hope of tomorrow. And this is what we can not really celebrate, but also give create an impact to our people and give them really a life, and also keep educating some others to continue expanding the services across the needy people, as the PS mentioned. Since then, Rwanda District Hospital has transformed into a center of excellence, offering specialized services in mental health, non-communicable diseases, surgery, and much more, as we visited some of them around here. And here we are reaching up to 260 people benefiting from the services, but also the numbers go beyond, because when you include Chirehe and Butaro, the services go to up to 1 million. And I think some other people keep coming, seeking the services that are being offered in different hospitals where PH operate. It is again a footprint that has been actually extending beyond Kayonza, as I said, now in other parts of the country. It was a legacy that went beyond medicine, because what makes Inshuti Mubuzima truly exceptional for us is not only the quality of clinical care, but also the deep humanity behind every intervention. That's why you could see the testimonies that we had from people that benefited from the services. There is this deep humanity, the connection, but also the life that people are having when they had lost hope to live any additional day. Whether it is now constructing dignified homes for vulnerable families, supporting malnourished children with food, covering school fees, or working alongside patients facing some stigma in the community or despair, PHI embodies the true spirit of accompaniment. We want really to thank you that beyond the medical services, but also you reach out to the communities providing some other needs. These again contribute to the transformation of social life of the beneficiaries, as well as the entire community of Ruingwavu and beyond. Dr. Farmer's contributions to Rwanda are really immeasurable. His belief in the dignity of every person helped to shape the health sector into one that prioritizes the poor, the marginalized, and those who would otherwise be forgotten. His philosophy that the poor deserve the same quality of care as the rich is not just a belief. It is now embedded in Rwanda's health vision. Again, through his leadership, the University of Global Health Equity was born, with the main campus in our very own Burera district in Northern Province. And UGHA is not only a medical school, it is actually a beacon of equity-driven education for the next generation of health leaders in Rwanda and beyond. To the family of late Dr. Farmer, we thank you. We really thank you for having traveled all the way to come and be with us today as we celebrate the 20 years anniversary of the services that you are benefiting from the legacy that he left behind. You are true friends. The name Inshuti mu Buzima is actually, it's a friend in health. And I said it was not chosen by accident. I think in Rwanda culture, a true friend is one who stands with you in your darkest hour. So you join when we are reconstructing, we are building the country, and you stand alongside us, the government, all together, visionary leadership by our president, and now we are enjoying the health services. We are hearing the testimonies from people. This is can just not go unnoticed, and we don't take it for granted. Now, as the Eastern Province and the country at large, we really reaffirm our full commitment to working closely with the partners in health and all partners to ensure that the legacy of equity and compassion continues to flourish. We want to pledge to strengthen this partnership to reach even more communities, particularly in rural areas where access remains a challenge. On this note, allow me to address a few words to non-English speakers, especially the community members that are here. Ibi bikorwa byiza batugejejeho yo kuba dufite ivuriro ndetse no kuba bafasha abaturage, bafasha mwebwe mu buzima busanzwe bwo kwiteza imbere. Icyo twakwifuza twakagombye kuba dukora kugira ngo natwe tubungabunga ubuzima bwacu. Burya mu buvuzi cyangwa gukunda ubuzima bwawe biba bisaba no kwirinda indwara zitandura, dukora siporo, tugabanya inzoga ku bazinywa cyangwa tukazireka, ko kuzireka ntawe byishe. Ikindi no kugira ngo tugire isuku aho dutuye kugira ngo n'indwara zishobora kuba zaturuka ku isuku tuzirinde. Kugira ngo ibyo nabyo bizadufasha kugira ngo dukomeze tugire ubuzima bwiza. Burya nicyo banatwifuriza. Ariko n'uwaba arwaye, ibitaro birahari byamufasha, ariko natwe tukagira n'urundi ruhare. Ikindi ni ukugira ngo ibi byiza dufite baduhaye hano mu bufatanye dufitanye tunabibungabunge. Mwateye ibiti, muribuka Dr. Paul Farmer babwira ati muze dutere ibiti, mwarabiteye, mwanakomeje naho mutuye. Let me just switch a little bit in English. You help me to translate that. Actually, the people, the surrounding communities, and also the patients, when they joined this hospital, looking for medical treatment for their illness, they join with that enthusiasm. Actually, this is a home for them. They just don't come for medical treatment. And remember, with the mayor, when we visit and we come here, we enter this facility, and we realize that actually the transformation of this area is not just to see the hospital, but also is to feel it in the communities, and we read it from their faces. We thank you so much for that. As I conclude, let it be more than a look back. Let it also be a call forward to deepen our commitment, to widen our impact, and to dream even bigger for the next 20 years and more to come. On behalf of the people of Rwanda, Eastern Province, Kayonza and Kirehe and others, want to thank you for being true friends. I want to thank you for believing in our people. I want to thank you for choosing to walk this journey with us with humility, with love, and with vision. Congratulations on 20 years of transformation work, and may the next chapter be more powerful. Murakoze cyane. God bless you.
a huge thank you to our guests of honor. Thank you so much. We are also grateful for reaffirming that there is a continued collaboration with us. We are really grateful that you will continue to have our back. So I will not be translating in Kinyarwanda because he already did, but there is only one sentence that he wanted me to translate. Hari ahantu hamwe byinshi mwabyumvise yagerageje kubitubwira, ariko icyo yashatse ko ncaho akarongo ni uko impinduka zabaye i Rwinkwavu ntabwo ari uko tubona ibitaro byiza, ahubwo iyo tugeze muri community turabyumva abantu barabitubwira, tubasha no kubibona ku maso y'abantu koko ko habaye impinduka.
Urakoze Anne. Twongere tubashimire nyakubahwa Governor. As we draw the formal program to a close, we want to extend our deepest gratitude to everyone who has joined us today, our staff, partners, government representatives, and all our friends.
We are closing the ceremony, but we can't do that before we acknowledge the logistic team and the planning committee for organizing this wonderful event and for making it a wonderful experience. Can we give them a hand again?
Yes, 20 years is a remarkable milestone, but it's also a springboard. We look forward to many more years of continued partnership, innovation, and an unwavering commitment to health equity in Rwanda.
Thank you everyone for a wonderful day. We are also grateful to different news outlets that are here with us. Thank you so much, and we hope to see you sharing our stories with the rest of the world. And now I wanted to invite everyone to join us for a celebratory lunch. We have two stations, but first of all, I would like to invite these three tables to make their way behind the tent and to share with us some lunch.
Something small before we go for lunch. I've been asked to give a request. Farmer family, our guests, we're going to have a group photo at the photo booth. Protocol is around. They're going to give us directions before we head on to lunch. Thank you.
Thank you, everyone. Have the rest wonderful weekend. So the IMB staff, as usual, we will let our guests go first. Thanks.
Protocol, please.
Please follow our ashes.
God has sent me to